if you take medicine, you lower down the risk. But on the other hand, you must make sure that you take the medicine, your diabetes been controlled according to the target. My name is Dr. Mohd Daud Sulaiman. I'm currently the consultant cardiologist in KPJ Damansara 2 or KPJ Damansara 2. So basically, when we do exercise, we actually stimulate our heart to pump harder and to circulate the blood through our circulation. Okay, how does this particular exercise help to improve our health, especially heart health? Is that first, when you do a regular exercise, okay, when we say regular exercise, about you do every other day, about 30 minutes, 4 to 5 times a week. The exercise that involve like brisk walking, jogging, running, cycling, swimming, this actually can improve first upon time your heart rate will lower down. So it helps in terms of your we call it the cardiovascular heart health. Okay, number two, this regular exercise also helps to reduce your blood pressure. So in a way, because we know that hypertension or high blood pressure is one of the risk factors for heart disease, especially the coronary artery disease. Okay? And thirdly, by doing exercise also, it's actually also improve in terms of your stress management. So that also helps in terms of your heart or cardiac health. So these are basic things which is simple, but if you do it regularly, as I mentioned earlier, it helps to improve your body circulation and in a way improve your cardiovascular heart health. Yeah. Okay. Normally, when we say about cardiac or cardio exercise, or the other word we call it like aerobic exercise, we actually talking about when you do exercise, it improve your your circulation and your heart pump. So basically, the exercise that improve these are basically like brisk walking, running, jogging, swimming. But unlike the in terms of like weightlifting, this is what we call it isometric exercise. It's not an aerobic exercise. It helps, but it's not as good as doing the more time spent doing the aerobic or the cardio exercise. So basically, when a person want to improve their heart function, they should do both, but they have to focus more time by doing during the exercise session, by doing this the one that you mentioned about jogging, brisk walking, swimming, cycling, and they may add up with this weightlifting or body toning, we call it. Nowadays we call it body toning, isn't it? So I mean, both are important, but in terms of heart, cardiac or cardiovascular health, or to improve your heart function or circulation, reducing your blood pressure, as I mentioned, is you have to maintain this aerobic exercise. Yeah, but of course, normally what I normally advise my patients is that, okay, if you spend probably 30 minutes in the gym, okay, you spend about 20 minutes doing the aerobic exercise, another 20 minutes for your body toning, such as like body lifting. Or if you do it 1 hour, probably you spend 40 minutes, then 20 for the cardio or aerobic, and then another 20 minutes for the body toning or sort of like body lifting, or weightlifting, I would say. Because this aerobic exercise, and in other words, it actually improve your oxygen delivery to your heart muscle and your body. So that's when we call about aerobic, meaning to say by doing exercise, by stimulating the heart blood circulation, it improves the oxygen delivery to your body. So it improves your health. Yeah. I mean, basically, when we talk about heart disease, there are those who have a heart disease, especially when we talk about, there are many heart disease. Of course, when we talk about exercise, mainly we're talking about coronary artery disease. Yeah. So it depends that, okay, heart patient, meaning to say there are heart patients that they don't have any history of heart attack. So they underwent this angioplasty, balloon and stenting. They went through bypass, but their heart is still normal. So upon recovery for angioplasty, if you do a planned angioplasty, the next few days you can start your exercise if you have no heart attack. Let's say like bypass, if you have no heart attack, your heart is strong, after 2 or 3 months after bypass, we allow you to go back to your staggered mild to moderate to intense exercise. Those who have a heart event or heart attack, they have a heart attack, their heart's weakened. So this is the one that, despite doing angioplasty or bypass, they need to undergo this physiotherapy or rehabilitation, and advised by their cardiologist or physician for them to gradually stagger their effort and the load of exercise. Okay, today we discuss about exercise, so basically try to maintain your exercise, especially aerobic exercise, 15 minutes a day, 15 to 30 minutes every other day. If you can't, or maybe over the weekend, do it 1 hour per session, and range from this brisk walking, trekking, jogging, running, swimming, cycling, and you may add up with some sort of like all this isotonic or weightlifting exercise, body toning, but focus on the aerobic exercise. That will help to get your heart rate lowered, which is good for your heart, lower your blood pressure, and that will actually improve also at the same time. This exercise will improve oxygenation to your heart and also to your muscle in the body.